Good afternoon, friends. Today we have just gathered here to speak on a very special topic, that is diabetes and COVID-19 infection. And we all know 2020 has been marked by a dreaded virus infection known as COVID-19, which has held the world to ransom starting from March 2020 till date as we speak. It has destroyed countless economies, wreaked havoc on the healthcare scenario of most countries including India. It has caused more than 2 million deaths worldwide, and India is the world's second most affected country with regard to COVID cases, along with the US. So those aspects of COVID is already in the public realm, but what we are trying to do today is give a new insight with regard to how diabetes is a very poor prognostic indicator for a patient once he or she contracts COVID-19. Now, what you should know is COVID virus harmful effects or the mortality is purely due to the inflammatory response the virus triggers inside a human body. When a healthy person is infected with COVID, if that person is having a good BMI, meaning less than 25, and the patient does not have diabetes, most of those patients, let's say more than 60% of those patients, make good uneventful recovery. Unfortunately, we all know India is the diabetes capital of the world, and of that, among the states itself, Kerala is the number one among all Indian states with regards to diabetes. So what happens is, now suppose a diabetes patient is afflicted with COVID, what happens? So for that, you should know that coronavirus is the family of virus that causes the COVID-19 infection, SARS-CoV-2. And diabetes is a condition where there is impaired insulin functioning inside your body that causes a rise in the blood glucose levels. So what happens is, a patient with diabetes, that too a poorly controlled diabetes, meaning an HbA1c of more than 9, FBS of more than 160, ppbs of more than 250, who is having diabetes since more than 5 years, if he or she by misfortune contracts the COVID-19 infection, the body mounts an inflammatory attack to contain the virus the same way as it does with a non-diabetic patient. Unfortunately, the presence of excess sugars in the blood magnifies or compounds the side effects that are experienced by the patient. And those side effects are manifested by various symptoms or signs like breathlessness, high oxygen requirement, fast progression of the pneumonia and fibrosis in the lungs called lung scarring, and the oxygen requirement and ICU admission is seen 10-fold or 20-fold more times in diabetes patients with COVID than in non-diabetic COVID patients. And it makes the prognosis and recovery of the patient far slower than a patient with no diabetes or well-controlled diabetes. So basically, there are two angles to this. One is a person with diabetes getting COVID. You will see that the patient who is already on an oral hypoglycemic agents or already on insulin require 10 to 20 times more dosage of those insulin molecules when they are afflicted with COVID. Because when COVID comes, such patients go into respiratory distress, and we usually use IV steroids to cover that respiratory distress with high flow oxygen requirement. So when that happens, when you give steroids, that automatically causes a rise in sugars. So let us say a patient who is on 10 units of Fiasp or short-acting insulin 3 times a day may require up to 15 to 20 units of Fiasp per each meal dose when he is afflicted with COVID because of the high insulin requirement. Similarly, a patient who was on, let's say, 10 to 15 units of a basal insulin like Lantus, the requirement goes up to 20 to 25 units of Lantus at bedtime just to keep the fasting sugars under control. Now, if you don't control the sugars properly in a COVID patient, the patient invariably ends up in non-invasive ventilation. Of course, in life-saving measures, some patients go into intubated ventilation, and as seen in metro cities of India, most of them end up with ECMO also as a last life-saving measure to, bring them from the brink of death in COVID infections. Now, let us see another scenario: a patient without diabetes getting COVID. Like I said earlier, COVID is a disease that can cause an inflammatory response even on the beta cells of the pancreas. So that causes impaired insulin secretion from the pancreas, leading to new-onset diabetes in a patient who has been afflicted with COVID-19 infection. So whether it is a patient with already pre-existing diabetes or a patient who has developed new-onset diabetes after COVID infection, both ways, 3 weeks after the patient recovers from the COVID-19 infection, he or she will require high flow oxygen requirement initially with COVID treatment protocols, but their insulin requirement also shoots up to 10 to 20 fold times higher compared to a patient who did not have COVID. So let us say a patient who is recovering from COVID is already diabetic. The high dose insulin requirement will continue to be there for maybe 2 to 3 weeks after the patient recovers from COVID. So initially pre-COVID patient's insulin requirement was 25 to 30 units, but post-COVID it goes up to 60 units. But 3 weeks from the time the patient recovers from the COVID, the insulin requirement again goes back to the previous 25 to 30 units. Similarly, a patient who has a new onset diabetes after COVID may require good oral hypoglycemic agents like a gliptin or a metformin or an SGLT2 with insulin requirement for the first 2 to 3 weeks after the patient recovers from COVID. Eventually, new onset diabetes can be managed only with a metformin or a DPP-4 inhibitor like a sitagliptin. But the key point to note is, if this diabetes is accompanied by an obesity, BMI of more than 30 for males and more than 28 for females, the severity of symptoms is almost double than that of a non-COVID patient, COVID patient without diabetes or obesity, and such patients invariably end up for 10 to 15 days in the ICU requiring either a non-invasive ventilation or a high-flow nasal oxygen requirement. So this elaborates the importance of good sugar control in diabetes patients and the part of the clinician to prevent new onset diabetes in a patient who has newly been diagnosed with COVID-19 infection. And those of you who are obese and have still not had COVID-19 infection, I would request the audience to pay special attention to your weight, make efforts to exercise daily, reduce your BMI, reduce 2 to 3 kilos. Those of you who have diabetes, make sure your sugars are kept under control with HbA1c of below 7.5. Those who don't have diabetes but who are on the obese side, there is no harm in taking a metformin 500 mg to induce at least 1 or 2 kilo weight loss as a pre-diabetic measure before you actually contract COVID. And to sum up, I would just say the treatment protocols for diabetes and this COVID pandemic era is diet, exercise, healthy eating, and seeing your doctor on time whenever you feel your sugars are not well controlled. And by that I mean an FBS above 120, PPBS above 160, HbA1c of above 7. Definitely it is time to see your doctors. And for those of you who have HbA1c of above 9 to 10, during COVID it would be very advisable to keep in touch with your doctor via telemedicine once in 2 weeks by regular self-monitoring of glucose or by using newer devices like continuous glucose monitoring systems. We are always there to help you. Those of you who are reluctant to come to the hospital, please make use of the telemedicine app developed by Lakeshore Hospital, and you can consult with us online either through video calling or WhatsApp. With that, thank you.